Hello, today we are going to talk about vaccination during pregnancy. The most important is the tetanus toxoid vaccination, and we are going to talk about its schedule for pregnant women and women of childbearing age. The aim of this vaccination is to prevent maternal and neonatal tetanus. So, all women giving birth and their newborn babies should be protected against tetanus. What is tetanus? Tetanus is a serious illness contracted through exposure to the spores of the bacterium Clostridium tetani, which live in soil, saliva, dust, and manure. The bacteria can enter the body through deep cuts, wounds, or burns, affecting the nervous system. The infection leads to painful muscle contractions, particularly of the jaw and neck muscles, and is commonly known as lockjaw. People of all ages can get tetanus, but the disease is particularly common and serious in newborn babies and their mothers, when the mothers are unprotected from tetanus by the tetanus toxoid containing vaccines. Tetanus occurring during pregnancy or within 6 weeks of the end of pregnancy is called maternal tetanus, while tetanus occurring within the first 28 days of life is called neonatal tetanus. The disease remains an important public health problem in many parts of the world, but especially in low-income countries or districts, where immunization coverage is low and unclean birth practices are common, either using non-sterilized instruments or hands, or through giving birth with traditional birth attendants without enough cleaning and sterilization process. The incubation period of tetanus varies between 3 and 21 days after infection. Most cases occur within the 14 days. In neonatal tetanus, symptoms include muscle spasms, which are often preceded by the newborn's inability to suck or breastfeed and excessive crying. The majority of reported tetanus cases are birth associated among newborn babies and mothers who have not been sufficiently vaccinated with the tetanus toxoid containing vaccines. The WHO reported that in 2015, about 34,000 newborn died from neonatal tetanus. However, it was considered as a success, since this is a 96% reduction since the late 80s, largely due to the scaled up immunization with the tetanus toxoid containing vaccines. This is the reference from the WHO. What are the requirements for having the tetanus vaccine? This is from the WHO policy regarding the tetanus toxoid vaccination program. That should be a national policy and national strategies to achieve high vaccination coverage with the tetanus toxoid among pregnant women, and they are available and are correctly implemented. In countries with areas at high risk for maternal and neonatal tetanus, strategies and plans to implement a high risk approach, including vaccination of women of childbearing age, are in place. Antenatal care providers have been trained in tetanus immunization. This is very important. The vaccine equipments and supplies like refrigerators, syringes, needles, etc., need to conduct tetanus immunization are readily available in health facilities, particularly at the antenatal care services. All pregnant women are issued a personal immunization card, which should be available for reference at each antenatal care visit and at any other contact with the health system throughout life. Health education activities to increase community awareness of the importance of tetanus immunization are carried out. And maternal and neonatal tetanus are included in the national surveillance system. These are all guidelines for the tetanus toxoid program. Now, what about the dosage? There are 5 doses. The first dose at first contact with health personnel as early as possible in pregnancy, usually after the first trimester. It doesn't give any protection, this first dose. So there should be second dose at least 4 weeks after dose 1. And it should be given several weeks before the due date if given during pregnancy. And it gives protection for 1 to 3 years only. So during the first contact with the antenatal care, pregnant women should be given the first, then a second dose in a month after. Third dose, at least 6 months after dose 2 or during the subsequent pregnancy. And it gives protection for at least 5 years. Dose 4, at least 1 year after dose 3 or during the subsequent pregnancy. And it gives protection for 10 years. The last fifth dose is at least 1 year after dose 4 or during the subsequent pregnancy, and it gives protection for all childbearing age year and possibly longer. So it gives full protection for pregnant women by 5 doses. However, if the woman has not previously been vaccinated or if her immunization status is unknown, we give 2 doses 1 month apart before delivery. And if the woman had 1 to 4 doses of tetanus toxoid in the past, we give 1 dose before delivery, several weeks before the due date of delivery. Tetanus protection at birth rate. This is a rate which is the percentage of mothers with the last live birth in the 5 or 3 years preceding the demographic health survey. This is from the demographic health survey site in 2015 to 2019, who received sufficient tetanus toxoid injection to provide protections at birth, which is at least 2 doses. Okay, these are some numbers I put it from Stat Compiler from the DHS webpage, and you can see that none of the country reached 100% protection. The highest, like India, was 89%, and there are countries, in spite that they are high, considered of medium income countries like South Africa or Jordan, they have less than 1/3 coverage. And then you can see that many countries did not reach even half of their women are protected from tetanus infection. This makes the risk of tetanus during birth and for the neonate is still there. And it didn't differ with the economic status of the country, as there are countries like Sierra Leone or Senegal which are considered low income countries, however, they have higher coverage. It depends on the policy of the country to follow and to implement the guidelines of the immunization coverage. There are vaccines to avoid during pregnancy. Generally, vaccines that contain killed inactivated viruses can be given during pregnancy. Vaccines that contain live viruses aren't recommended for pregnant women. Examples like measles, mumps, and rubella, the MMR vaccine, the varicella chickenpox vaccine, live attenuated influenza vaccine. So there are some vaccines we cannot give during pregnancy. These are some references and reading. You can download them and read it. Okay. Thank you and see you in the next lecture. Bye bye.